Our next presentation comes from Lenox Hill Hospital. It's titled A Retrospective Comparison of Standard Duodenal Switch with Loop Duodenal Switch at a Single Institution, presented by Dr. Cottam.
All right. I'd like to thank SAGES for allowing us to come do this presentation. This is a study, it's a retrospective review of a prospectively kept database comparing the SIPS procedure with the laparoscopic duodenal switch. These are disclosures. The literature background. In 2007, Torres, who's from Spain, introduced the concept of the single anastomosis. He started doing these with a 200 centimeter common channel. In 2011, due to malnutrition complications, Torres switched to a 250 centimeter common channel. And due to continued malnutrition, in 2014, he switched to a 300 centimeter common channel. Background of this study, in 2011, the Bariatric Medicine Institute of Utah, or BMI, began doing the laparoscopic duodenal switch. After performing 63 of these, they switched over to the SIPS procedure because of malnutrition rates. The SIPS procedure slightly modifies it towards the original technique by using a smaller sleeve and a 300 centimeter common channel. And once again, this is a retrospective on a prospectively kept database. Here are the two procedures. On the right, you can see the laparoscopic duodenal switch. In our practice, we do this using a 150 centimeter Rulim and a 150 centimeter common channel. And on the left, you see the SIPS procedure where there's no Rulim and we use a 300 centimeter common channel. The baseline data, I'd like to point out that the BMI, the weight, the female to male ratio, and the diabetes are statistically insignificant, the differences. And we have follow-up of 67 and 65% with the SIPS and laparoscopic duodenal switch respectively. And we have performed 121 SIPS procedures, and we have 63 laparoscopic duodenal switches. Here we have our excess weight loss through time for a laparoscopic duodenal switch. We did this using a nonlinear regression on the data. As you can see, at about 1 year, we have around 80% excess weight loss. And if we overlay the SIPS procedure on this, you can see it's very comparable with, at 1 year, we have about 77% excess weight loss, which is statistically not significantly different. If we look at the BMI of these patients, we started with BMI of about 50, and the average patient undergoing the laparoscopic duodenal switch can expect to lose about 20 points of BMI. And if we overlay the SIPS procedure, the patient undergoing SIPS can expect to lose about 18 or 19 points of BMI over 1 year, which once again is statistically not significantly different. And if we look at the complications for the laparoscopic duodenal switch, now these were our first 63 cases, so there is a learning curve. But we'd like to point out that there's 5 malnutrition complications, which we thought was an unacceptable amount. We also have 8 people that had chronic nausea and 8 people that had chronic diarrhea, which we thought was also unacceptable. Now, if we look at the complications for SIPS, you see we have 2 malnutrition complications, but we also this occurred because the surgeons in the learning curve with this procedure did not measure out the 300 centimeter common channel correctly, and it was 180 centimeters. So all patients that underwent the surgery with 300 centimeters did not have malnutrition problems. We'd also like to point out that we had 4 patients with diarrhea, but we also had 2 with constipation, and the diarrhea was easily treatable. So in conclusion, the SIPS procedure has comparable weight loss with the laparoscopic duodenal switch at 1 year. The SIPS also has less malnutrition than the laparoscopic duodenal switch, and the SIPS has less overall complications than the laparoscopic duodenal switch, but we won't put too much stock in that because of the learning curve of the duodenal switch out of practice. I'd like to thank Sages for letting us present and open up for questions.
Questions?
Hi, Brandon Williams, Vanderbilt. Are you able to bill and code the SIPs as a regular duodenal switch?
Can you say that again?
Billing, coding, what do you use for the SIPs procedure?
Maybe I'm slightly deaf.
He's asking what billing or coding numbers you use relative to the laparoscopic.
We use the same coding for the SIPS procedure as we do for the laparoscopic duodenal switch because there is not a technical code for it.
Peter Gorecki, I was wondering whether you had any measurement of the common channel length, because small bowel length can be highly variable between 8 feet and 15 feet. So you made a 300 centimeter from your duodenum, transsectional duodenum, but whether distal limb was measured, and whether, if yes, whether you had any differences in weight loss between those with a rather smaller common channel versus those with rather longer common channel.
The common channels for all the duodenal switches, we measure from the ileocecal valve, so they're all the same length, even though everybody has a variable amount of intestine. And the people with less common channel in Torres' paper lost more weight, but they had significantly more malnutrition, and it's not desirable.
Amador Garcia from Barcelona, Spain. Congratulations for your presentation, very nice. Do you have any biochemical data related to protein, albumin, or so?
For the protein levels, we don't have the protein levels in this presentation, but none of the patients that underwent the SIPS procedure had any abnormal protein levels at 1 year.
I was just wondering, how much follow-up did you have in these groups? Because we've seen in a lot of the studies that follow-up, right, only 25% of the people are coming back, or 50% of the people. In each of these groups, how many people came back?
I believe I mentioned that, but I had 67% follow-up for the SIPS out of 121 patients at 1 year, and we had 64% for the laparoscopic duodenal switch.
Very nice. I think that's one of the biggest concerns with these duodenal switches is that if we lose these people to follow-up, malnutrition can be a really serious problem, and that's what keeps a lot of people from doing them. Dr. Felix?
Yeah, just a comment. I think we should all applaud the presenter and realize that he's a college student. It's Dr. Cottam's son, I just found out, and I think that if he was my son, I'd be giving him a hand.